Is gestational diabetes really worth worrying about? Well, I've invited on Robyn Compton, who is a diabetes dietitian and is going to explain the long-term risks of gestational diabetes so that you can make some informed decisions. Stay tuned. So today I'm very excited to have Robyn with us. So welcome, Robyn.
Thanks, Mel. Nice to be here.
Now, can you tell us a little bit about what you do and how you came to specialise in this area?
Sure. Well, I'm an accredited practicing dietitian like yourself, and I have a private practice in Melbourne at the Royal Women's Hospital, and my area of special interest is gestational diabetes. But I also see women who have other nutritional issues in pregnancy. It might be managing their weight, dealing with morning sickness, vegetarians, and a lot of women who are trying to conceive will come and see me and chat about how to maximise their nutrition and fertility as well.
Fantastic. Now, today we're talking about gestational diabetes. Can we start by explaining exactly what that is?
Yes, so gestational diabetes is a type of diabetes that occurs in pregnancy. So the placental hormone overrides the insulin activity, and that leads to higher levels of blood glucose. So glucose can cross the placenta, and that can have short and long-term impacts on the baby. Some groups are more at risk of developing it, so particularly women who have a family history of type 2 diabetes, women who are overweight or obese, older mums. There's a condition called polycystic ovary syndrome that increases the risk. And of course, there are certain cultural groups that are particularly at risk. Indian, Asian, Middle Eastern and Indigenous groups, there's a greater prevalence.
Yeah. Now, it's becoming more and more common now. We're hearing about it quite regularly. And so I think sometimes when you hear about something more regularly, people become a little bit more blasé about it. So can you tell us about what are actually some of the long-term risks to both mum and to baby? And so why is it actually important that people do anything about it?
Yes, look, gestational diabetes occurs in the pregnancy, but there are long-term health risks, and the major one is the increased risk of type 2 diabetes. We know that women who have had gestational diabetes are 3 to 7 times more likely to develop type 2 diabetes in the next 5 to 10 years. And I see plenty of women coming through my doors that say, "Hi, remember me? I came to see you with gestational diabetes. Now I've got type 2. We also see double the rate of cardiovascular disease in the next 10 years. And there are short and long-term impacts on the babies as well. So that's why it's an area that we do need to put a bit more focus on.
Yeah, and so in terms of those risks to baby, what are some of the biggest concerns there?
Sure. So if the diabetes is not managed as well as it should be and excess glucose is crossing the placenta, that can make the baby grow big. And that's called macrosomia. And obviously a bigger baby, there's issues with delivery. Babies also have a greater risk of low blood sugar at birth when they're suddenly cut from the maternal blood glucose. That's in the short term. But then in the longer term, we're seeing that there's evidence that babies that are born larger may have a greater risk of childhood or adolescent obesity and down the track type 2 diabetes.
Yeah, and of course we're seeing such high rates of both diabetes and obesity now, so really it's a good opportunity for mums to be making a difference for their child's long-term health.
Absolutely, and if they look after the diabetes well and their babies are born within the normal weight range, that's giving them a good start in life for sure.
Fantastic. So Robyn, if you have gestational diabetes in your first pregnancy, does that mean that you're definitely going to have it in your next pregnancy?
Not definitely, but there is a 48% recurrence rate of gestational diabetes. We know that gestational diabetes is linked with overweight and obesity, about 46% association. So obviously if mum can try and lose a bit of weight after that pregnancy before the next pregnancy, that can reduce the risk. And I have seen women lose weight between pregnancies and not get it in the second pregnancy. But of course, age is a risk factor, so you don't want to delay the next pregnancy to be the perfect weight.
Yeah.
Do the best you can over that couple of years in between babies, and that will help with the next pregnancy.
Great advice. Any other tips that you'd like to share with us today?
Yes, well, interestingly, breastfeeding is protective, and of course, breast milk is best milk for baby. If possible, if mum can breastfeed, that's fabulous. And some studies are showing that if you breastfeed for a year, it can actually reduce the incidence of type 2 diabetes later in life as well.
Oh, fantastic. Well, thank you so much for joining us today. You've been a wealth of information. I'm sure everyone's really appreciative. So
Thank you for asking me. I appreciate it.
Oh, that's wonderful. And for you guys out there, hopefully you got some great advice from this video. I would love you to type in the chat box below if you have any other questions about gestational diabetes and the long-term risks in particular. And check out our other videos on Nourish. We have some other videos, particularly around gestational diabetes, and of course lots of other tips about what to eat to have a healthy pregnancy. And in fact, I have a special gift for you. I'd love you to go and download my free pregnancy meal plan, which will help you to reduce your risk of gestational diabetes. Just go to www.melaniemcgrice.com/pregnancy. And I look forward to seeing you in my next video. Oh, good. Oh, excuse me.